I would hope that no leader in our country is easing public health vigilance because they feel pressure not to shut down businesses or slow down our economy. I understand that worry, but let me tell you, that's how we end up with businesses going out of business and the economy damaged even more. Beating COVID is the only way to protect our economy.
So, Nick, we're seeing this, I guess, this pressure on the federal government between economic concerns and health concerns. And the provinces, meanwhile, I think in Ontario, Ontario Premier Doug Ford is wanted to reopen restaurants in Toronto, for example, but at the local level, places like Toronto have decided not to do that. So it seems kind of like a downloading of responsibility at this point, with the Prime Minister asking provinces to act.
Well, the thing is back at the beginning of the pandemic, if we all remember, it was one big happy hug between the federal and provincial governments. Everyone was on the same page. Everyone was supportive of each other. The federal government was pumping not just stimulus into the pockets of Canadians and Canadian enterprises, was helping provincial governments kind of cope with the pandemic. Fast forward, and now we're into November, and what we're seeing is a little more friction. Why don't we say not a lot of friction, but more friction, at least compared to the past. And I think a lot of this has to do with the fact that a lot of Canadians are frustrated. And in our polling, when we ask Canadians what the top national issues of concern are, you can see definitely a second spike of concern, where upwards of 4 out of every 10 Canadians identify coronavirus as their top national issue of concern. Jobs is at around 12%, healthcare is at around 9%, and so as a result, I think for a lot of Canadians, there's still anxiety on like, how long is this going to work? What do I need to do? And what does this mean for the future? And you look at some of those Ontario numbers in terms of active cases, and they're really starting to increase. But there's one stat that I look at. It has to do with, I know this sounds so morbid, excess mortality rate measured by StatsCan. That is a difference in the number of deaths in Canada for over like this month or one particular month compared to a month ago. And when you look at the trend line prepared by Statistics Canada using the Canadian Health kind of data that's shared, it's quite interesting when you can see that the trend line veer up at the beginning of the pandemic, where there are definitely more excess deaths. But check out the trend line in June, July, and part of August. You can see the number of excess deaths goes down and is the same as the year before. I guess in this particular case, you could argue, and there's a little bit of a spike, at least in the last part of the tracking, but you could argue that the beginning of the pandemic was a pandemic. There were more Canadians that were dying as a result, but that the summer, here's an existential question. If more Canadians aren't passing away, is it really a pandemic that is lethal? And it speaks to the fact that I believe one of the reasons why it's like this, even though the number of cases are up, is because Canadians are doing a better job at responding. The healthcare system is doing a better job at responding. There's social distancing, masks, and all those things, that even though the number of cases are going up, the mortality rate at least seems to be under control now, much more than it was at the beginning of the pandemic.
I guess the hope too is I think at the beginning of the pandemic, we saw outbreaks in long-term care homes where more, it was a more vulnerable population was getting it, and therefore the mortality rate was rising. I think we're seeing a bit of that in Manitoba now, but the hope is that we obviously do not see that, over this winter.
Yeah, and to your point, Michael, the bulk of the people that have passed away as a result of the pandemic have been over 60 years of age, remain over 60 years of age. That young people, although they are getting the virus, they're much less likely to be vulnerable and to pass away as a result of getting it.
And also in the mortality rates that you're talking about, which goes beyond anything related to COVID-19, we're also seeing, I guess, the danger is that ICUs reach capacity and the overall healthcare system gets overwhelmed and is unable to deal with other issues, which obviously you have to be careful with.
Yeah,
I'm
well,
not, yeah.
Ontario numbers on that front are interesting because about when we look at the trend line, I think in this particular week there were 400 Ontarians that were hospitalized as a result of COVID. At the beginning of the pandemic, it was upwards of 1,000. So even though the cases are much higher than before, the hospitalizations are much less than at the beginning of this.
We're certainly getting better at treating it. C2 National News medical specialist Avis Favreau has done a lot of reporting on amazing advancements in treatment for high risk COVID-19 cases. So we definitely have come a long way. Nick, I'm just curious about the messaging from our leadership now. It seems like it's sort of a patchwork of across the country of what you should do and what you should not do. I just want to play a clip from CTV Ottawa's Graham Richardson talking to Dr. David Williams.
With all due respect to both of you and to your entire team, I really think everybody has tuned you guys out. Like, I just don't think the behavior is changing, both anecdotally and the numbers. The averages here in Ottawa over 7 days are actually down. But what do you say to the notion, like, Dr. Williams, you're talking about aspirational things, about getting people to change their behavior. I really think they've tuned you out. And how do you get them to not tune you out? Because these numbers are just, they're telling a very different story than what you're talking about.
Well, yeah, I think you raise a good point. What's tuned in, tuned out, or what are people saying, I've had enough, I'm going to do my own thing, and I'm not sure that's me in particular. I think is some concern about generally as people say, well, in other sectors we watch what's going on, we see what's happening south of the border, the portrayal of different perspectives in the media and the social media, and so people are, I think, at best confused on the matter.
So what's your takeaway from this, Nick? Just this sort of confusion over, who you should pay attention to.
Well, one of the key takeaways, and this is the odd part of what's happening more. Now we're having public health officials disagreeing with each other, and also disagreeing with pick your government, the Ford government or the federal government. And I think this is not good from a public health perspective. To have some healthcare practitioners and experts kind of sniping at others and having differing opinions from whatever the governments are doing, because the governments at least have been saying or advancing a narrative that they listen to the experts. But what do you do if the experts don't agree? And I think that's the problem. And I think what we have to watch out for is that Canadians generally start to tune out to what the experts are saying because they're disagreeing, and that would not be good from a public health perspective or from a public policy perspective. And I think public health officials have to kind of listen to that. In the ideal world, they're on this. For any country to beat and control the pandemic, the country has to be on the same page. They have to be working from the same playbook generally, and to have some certainty. But the problem is that. Think of it this way. Why don't we use Ontario as an example? In Ontario, they did, in order to fight an expected second surge, they put in more restrictive measures. They did not allow bars and restaurants to kind of serve indoors. So people did that, and they respected it because they were told by the public health authorities and the premier that our best science says that we need to close this in order to fight the pandemic. So everybody does this. Congratulations, that's good. However, what we've seen is an increase in the number of cases. So how do the public health officials and how does the government explain, well, to Ontarians, yeah, you've done everything that we've asked you to do, and there are more cases of COVID now than there ever have been in our tracking where there's a significant spike. So then people are wondering, wow, these businesses closed for the last number of days. They've taken a hit on their bottom line. They're economically at risk. And it was all for naught because the cases are still going up. And then people would be, I think, rightly saying, if restaurants and bars are a vector for spreading this, what's happening in order to explain the second spike? Because obviously they're not a vector because things are still moving in the wrong direction.
Now, and what does your polling have to say about economic concerns overall? I think the airline industry is still hoping for sectoral bailout. Are Canadians comfortable this winter with more funding?
Well, the thing is that we track economic sentiment on behalf of Bloomberg News every week. We ask Canadians a pretty simple question. Do you think in the next 6 months, will the economy get stronger, weaker, will be the same? About 13% of Canadians believe that the economy will get stronger in the next 6 months. A whopping 57% believe that the economy will get weaker. They're more pessimistic by a factor of 4 to 1. And I think a lot of this has to do with the uncertainty. The transition from CERB and that program to the new government employment program, and also uncertainty related to, will my job be there? Will my employer still be there? If my job is still there, will there be fewer hours? How long will these government programs continue? And all that uncertainty speaks to a significantly high level of pessimism when it comes to the future strength of the Canadian economy.